Hello, OT friends, and welcome to the Uncommon OT series. I'm Patricia Modis, and I'm your host, a Filipino-American, native New Yorker, currently based in Los Angeles, bulldog mama, and an uncommon occupational therapist myself for the past 22 years. On this podcast, you will hear me proudly feature the unique careers of occupational therapy practitioners working in non-traditional and role-emerging practice areas, settings where OT is uncommon. I invite you to receive a dose of OT inspiration, to learn, to think outside of the box, and to be energized and motivated to follow in these unconventional paths. Happy listening! Before we begin this episode, I want to extend a special thanks to Picmonic, our sponsor. If you are an OT or OTA student looking for an excellent learning resource and study aid, Picmonic might be for you. Whether you're studying for your classes or getting ready for the NBCOT exam, it is a visual mnemonic learning tool that has been research proven to increase retention and help students ace their exams. It uses audio-visual learning and intelligence-based repetition algorithms to help with long-term retention while studying. If you're interested in trying it for yourself, sign up today using the link in the show notes or using the code TRANSITIONSOT to score a discount of 20% off your Picmonic membership. Welcome back, OT friends. Today, I am very excited to introduce you to our guest of honor, Toni Solaru. Thanks for coming on, Toni. I'm really excited to dive deeper into your uncommon OT work. Can you get us started by sharing with us a little bit about yourself and maybe some of your favorite occupations?
Absolutely. First of all, thank you for having me on. I'm really excited to be here. I'm a fan of the podcast. Yes. Okay, great. I am here. I am in Chicago. I have been an OT for 7 years now. My background is in community-based mental health, psychiatrics, cognition, neuropsych. I've worked all over. Started out in acute care after I got tricked into it, and then inpatient psych for about a year and a half, and then community-based mental health for 2 years. And I've really just been all over the place. And then I went back to school, got my OTD, and then while I was doing all this, I was like, you know what? I need more. So then I was a professor for 2.5 years, and then worked a year as a functional cognition specialist. And then throughout all of this, working on Diverse OT National. So just a lot. I'm sure we'll unpack it. And some of my favorite occupations, I love hanging out with my friends. I love to read. I have a dog named Phoenix. You can follow her on Instagram at feeny.the.weenie. Pheenie. She's so cute. And I have a cat named Pickles, and they're so cute. And I just hang out with them all the time. And I've decided this year I'm really into like physical media. Like I'm gonna take pictures with my Polaroid and I'm gonna have the actual tangible things. Like I'm not gonna stream my movies. I'm gonna go back and get a DVD player or something. I don't know. I'm into physical media. So that's me.
Well, thanks for sharing some of that, Toni. I love hearing about your fur babies and your hobbies and, knowing sort of what meaningful occupations you're into. I love that. So, and also, you talked a little bit earlier about your work, or you started to tell us a little bit about your work and sort of what pushed or motivated or drove you into doing this work. Can you tell us a little bit more about that?
Absolutely. So I would say my when I was in my master's program, I was actually like really concerned. We were getting towards the end, and I was like, oh boy, I'm not really connecting with any area of practice. And I was like, what am I going to do? And then I had a level one in inpatient psych. And I was like, oh, this is what I'm going to do. This is what I'm going to do. I love this. I love working with people. I love the mental health side of OT. Huge, huge, huge fan. And so from there, I knew I wanted to work in mental health. I did another level or I did one of my level twos in mental health. And then that's what introduced me a little bit more into the political side of things because I was at Mendota Mental Health Institute. So that is a forensic psychiatric facility. So if someone ever, in a court case, they're not guilty due to mental status. Um,
Mm-hmm.
any of those pleas, you don't actually not go to jail. You just go to mental health prison, which I don't think
Yeah.
people. And so, or if someone during a trial is like, my client isn't fit to stand trial, look at their
Mm-hmm.
thinking, then you get sent to a place like Mendota where they it's called treatment to competency. I'm doing the because the words are all outdated. I'm very sorry, everyone. But it's
Mm-hmm.
treatment to competency. And so seeing if this person is competent to stand trial, that's where you would get that's how these decisions are made. So it's very interesting. I was on a maximum security unit and 3 months, but I saw a lot.
Mm-hmm.
See a lot. It was a lot. And just really started making me think more about the intersections of politics and carcerality and OT and justice and what is our role in any of this. But I knew I wanted to keep on figuring it out in a mental health capacity. Um, and so that led me into inpatient psych, which I loved. That was like I felt at home there. And it was the first place to really also push me on what I had learned as an OT, like what we learn versus what it's like actually interacting with real people and
Yeah.
real situations and real backgrounds, and seeing and meeting people from every walk of life, people very similar to me and people extremely different from me.
Mm-hmm.
And that just made me more passionate about humanity because here are so many people I've met and I've gotten to hear part of their story. And would I have ever encountered you otherwise? Probably
Yeah.
not. So I'm always thankful. I'm always thankful for my clients and my patients because it's a gift for people to share with you. Um,
I
and
agree.
yeah, it's I feel especially in mental health, especially when you working with people in crisis, the level of vulnerability and trust is, I don't take it for granted and I really respect the client therapist relationship. And so it was there that I started to get more curious about, yeah, I know about mental health and yeah, I'm practicing and I've been to school, but then I kind of felt like I owed my patients and myself more to know
Mm-hmm.
more about the brain, to know more about mental health diagnoses and etiologies and things of that nature. So that led me into wanting to, and that also made me understand, like to understand psych, you got to do neuro, you got
Mm-hmm.
to understand psych. And so that's what led me to apply to Columbia's program. And because I was like, okay, they've got a track in neuroscience and cognition. I can really go further and better myself, my knowledge, and what I can be doing.
Mm-hmm.
Standing. And also, I'm seeing areas for change that through this, while doing my doctorate, I could affect change. So initially, I knew I wanted to come in and find some way to create a culturally relevant mental health assessment.
Yes.
That's what I knew. And so Columbia was the only OTD program I applied to because I was like, it's cognition or nothing, baby. Luckily, I got in. Excellent program. Loved my time there. Had the greatest mentor there, Dr. Mendonça. I love her deeply. She pushed me really hard, and it was worth every moment. I loved learning. And so, yeah, those were kind of my motivations. And then the last
Hmm.
was was as I was saying, like I was in inpatient psych in 2020 during Black Lives Matter after George Floyd was murdered, and disability activists and psychiatric activists asking, what's the difference between the chokeholds you that was done on George Floyd that you're doing on patients here when they're forced to take medication or being held down, which were
Hmm.
all really hard truths to sit with. But it was something that deeply affected me and changed me and how I see and think about things. So I would say those are all my original motivations. Yeah.
Yeah. Well, thanks so much for sharing that with us. The great introduction, I think, to, what we're about to talk about in more detail, right? Your creation of diverse OT National, which is really addressing some of these talking points that you just mentioned. So this might be a great time for us to segue into that. Tell us a little bit more about Diverse OT National.
Absolutely. So, Diverse OT National, we are a 501(c)(3) nonprofit, and our focus is really on being a interactive learning network. Like that's what we are as a nonprofit, and we have a lot of moving parts to us. But I should back up a little bit and say we actually started in 2016 as a student club. So Caitlin Robinson, Dr. Caitlin Robinson, and myself, we met in 2015 at UW-Madison. We were in the OT program, and we were the only two Black students in the program. And that itself is, a tale as old as time in OT.
Mm-hmm.
We consider ourselves lucky, right? It's very easy to never encounter another Black OT within your career. It's very possible for someone to never ever encounter a Black OT. So we were like, whoa. Um, And so we were feeling a little of the strain and the pressures of being an underrepresented student in OT. We also were recognizing things within like our curriculum and our program where we're saying, "Hey, this is outdated," or "What about these groups?" or "What about this?" And raising those questions and wanting a place where we could feel seen or heard, and understood. And so we brought forward our concerns, and and were met with, the typical academic response, which is,
Mm.
well, we can't change our curriculum, or we can't tell professors what to do, or we can't do this, or that's not possible, or well, we'd have to send it to this person, to that, the bureaucracy of it all,
Mm-hmm.
just a lot of the roadblocks as to why we cannot change. And so Caitlin and I kind of looked at each other and said, okay, so what can we do? And I think that is always the most important question you've got to ask yourself. And the answer we came to is, well, we can start our own student club. What about that? We can build and create a space that is safe for us, that's safe for everyone. We can create a space where we can all learn the things that we want to be learning. So
Mm-hmm.
that is how that came along. Um, and so we worked and put our heads together, and four of our friends came on board to flesh out our first ever e-board. And we got up and running, coming up with our mission, vision, what it is that we wanted to see and what we wanted to be. And in that first year, it was cool. We had organized monthly meetings. So our cohort, the cohort under us, undergrad students would come. There'd be different guest speakers every month talking about different topics related to culturally relevant OT practice. So for us, it was learning more about the Hmong population
Hmm.
in Wisconsin. That's a huge population in Wisconsin. And so learning about specific cultural considerations and OT, especially something that I learned in the presentation was, a lot of times Asian people get lumped into the category of Asian instead
Hmm.
of parsing out the very different cultures of people and the very different histories and the very, it's just like considerations for Asian, and it's like, what does that mean? There
Yeah.
is there what do you what nationality, what ethnicity, and what groups within the groups. So it was nice to learn more about that and learn, hey, here are specific considerations about the Hmong population here in Wisconsin, and here are specific resources, and here are the things that, we had in our first year a speaker to come in to talk about Black women and maternal mental health. We had someone come in to speak about OT and the Muslim population is actually and learning more. And it was cool because it wasn't necessarily just OTs coming in. So he was actually a leader within the Madison Muslim community and a professor of Islam coming in to teach us, tell us about it, and say, oh, okay, this is the information that we want, that we're looking for. We also hosted interprofessional events, blah, blah, blah. I could go on. But it was cool to see student power. That felt
Hmm.
cool. That felt good to us. Like, hey, we can take control of things. We can change things and we can work together and come up, like, get a cool result. Uh,
Hmm.
and so we had our first year there, and it was kind of funny because after our first year up and running, we were actually off to clinicals. So we had to hand it off to Monica and Katie, who are on our board present day. We love Monica and Katie, and they took good care of diverse OT. And for us at that time, that was kind of that. Um,
Amazing.
yeah,
I love that you found each other, number one, right? Like
yeah.
it takes, it takes numbers sometimes when it comes to these things. And I love that you started out on such a grassroots kind of level.
Yes.
This was something that it seemed like you were kind of longing for. And congratulations on being able to organize and, come together and be able to offer and, find these resources and offer it to others.
Absolutely. Thank you. And then from there, it gets even more kind of grassroots. So this is the transition into nonprofit status. So once we graduated, Caitlin and I, we felt good about what we had done. We were like, great, there's now this space at Madison, and we love that. And one of the things is that, there was, I think, like OT Practice magazine or something. It was something that it wasn't even in print. It was like on this online website. Like, it's not even OT. I don't know what it was, but you truly, even if you Googled it today, you would not be able to find this article. But it was like a little blurb about diverse OT, our student
Mhm.
club, what we had done, da da da. And so about a year later, after we graduated, we get an email from students at Boston University. And they said, hey, we came across this article about you guys, and we'd love if Diverse OT could come to Boston. And we said, what? First of all, how'd you, this, like, I can't explain to you enough that you would not come across this article anywhere. Like,
But people were looking for the
like
same
it's a
thing.
literal paragraph. I'm like, how did you find this paragraph about us? But they were looking, and we said, oh, well, sure, but we have to figure it out. So in a way, Boston, our Boston chapter, of course, UW-Madison's our flagship, but Boston is kind of like our babies, because we kind of held each other's hands as we figured this out. We're like, okay, we will become a nonprofit so we can support you guys. And so we literally went to the library and checked out Nonprofits for Dummies and said, okay, well, let's begin. So we got the
And and
band.
Toni, this is as you're working as an OT in an acute care setting,
Yes,
right? This is all happening in
this is
conjunction.
all happening simultaneously. And so we said, okay, let's nothing to it but to do it. We got the band back together. So all of our friends who originally helped us start the club all said, okay, we'll come on board and do this with you guys, which I cannot thank everyone enough. And yeah, so Noreen, Sarah, Brittany, who am I blanking on? I'm also using everyone's real names because it's like Smalls, no, Mowgli. I'm like that's yeah, Kayla. I was like, oh. And so we got we how we started is when I was at this is an important part. So when I was at Ohio State, they had something there called the Innovation Studio. So Caitlin and I were able to team up with Marcus Williams at OSU. He's a PT because they were looking for interprofessional teams to come forward and pitch an idea. So it was like they called it was like their Shark Tank. So we came together and we worked on a pitch. And so I pitched diverse OT to them. And so it was a successful pitch. We had asked for $500 and we used that $500 to pay our nonprofit fee, to pay the fee.
Hmm.
And then UW Madison had a law and entrepreneurship clinic. So we applied to that, and that is how we were able to get lawyers to help us do all the paperwork. So when we started Diverse OT with $0.
Got it.
$0. Like there was no money, no guidance, no support, nothing. It was just us figuring it out every step of the way. And so we went from there. So it's like, okay, we've got our nonprofit status, we've got a board, we've got this chapter. Um, cool. let's let's rock and roll. And what does
Can
that
you
mean for us? Um,
can you tell us about your mission and your vision before we, skim through all of that? Because I think
Oh,
that's
yeah.
a
Thank you
big.
so much for getting me back on track. So we actually just recently updated our mission statement. So, through education, leadership, and collective action, Diverse OT National empowers occupational therapy students and practitioners to provide care that is inclusive, just, and rooted in the lived experiences of communities most affected by injustice. In our vision, we envision a future where all occupational therapists provide inclusive, just, and culturally relevant care.
Fantastic.
Thank you.
So important. And I think the what you're offering is really support for occupational therapists. You're offering training for occupational therapists. You're offering an opportunity for occupational therapists to really elevate themselves when it comes to providing culturally relevant care, particularly in my niche, in community-based work. That is huge, huge in terms of being able to connect with folks and really make the true difference, right? Can you give us some examples on the types of things that you offer in order for OTs to or to
I
gain this knowledge?
I'm so excited that you asked that question. Yes, so we have been working nationally to really step up our programming and our offerings for opportunities for learning together and for community. So there are a few different things going on. So the first is we actually just started a book club. Our first meeting will be January 22nd. It's called Reading for the Revolution. Uh, and so this is born out of, again, opportunities, first of all, 2 free CE credits. All of our programming is offered on a sliding scale basis with free entry always, 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 because we want to make sure all of our programming is accessible. That's very important to us. So we will be discussing the book The Viral Underclass by Stephen Thrasher. And so here it'll be an opportunity for OTs for us to come together and discuss the ongoing COVID-19 pandemic. What does that mean for us as practitioners? What does it mean for our practice? Should we be wearing masks? Asking hard questions and not necessarily me saying I'm coming in with the answers and I'm going to tell you all what it is, but saying I don't have the answers. Can we figure this out together? So that is one of our things. So yes, a lot of more opportunities for continuing education.
Yes.
So we also have our advocacy in action series that we will be starting in February. Our first session is February 1st, and it's a 4-part series. And with advocacy in action, we're really looking at, okay, we know that people in OT are looking to not just only learn more about um, equity and justice and occupational justice and all of those things. People actually want to be able to do something. And people also want a deeper understanding of these different topics.
Mhm.
A lot of times when we do talk about race, class, gender, sexuality, disability, if we talk about disability, um, it is it's either really quickly in like a course of yours, or maybe in your yearly DEI work training. But where is the space to really wrestle with bigger ideas, or understanding the different ways that politics really do shape what we're doing as OTs? So our four like I said, our 4 sessions. Our first one is Where Are All the Black OTs? A Brief History of White Supremacy in the United States. So this is a course where we are going to answer the question of where is the diversity within our profession, right? We hear that question all of the time. Where are the Black OTs? Where are the Indigenous OTs? Where are the disabled OTs? Where are the LGBTQ plus OTs? Where are the Asian OTs? And then we come to bad conclusions because we aren't contending with all of the things at play, right? So something
Mhm.
that I heard when I was in grad school, for example, when I asked the question, where are all the Black OTs? Kind of that's what gave the title because I actually said it out loud. And the response I received was, well, Black students just can't do the math. They can't get past math classes in undergrad. They can't get past the science in undergrad. They can't do the anatomy in undergrad. They can't do this. They can't do that. They can't. And then you hear responses like, and that is something that is so deeply wrong, but it's also a belief that is held across all higher education. And so then you start getting programs to help underrepresented students get into OT or get into this or get into that. but we're taking it from this very racist mindset of, oh, we've got to set up these programs for these people who can't do things. And
Mm,
that is not true.
yeah.
So when we're looking into this, we're asking the question, how do we create culturally relevant spaces? Or how do we recruit and retain OTs of color into this profession? Well, let's look how we got here, right? OT was founded in 1915. That is in an era of Jim Crow segregation. That's the law of the land. It is 1915. Black people are not allowed to attend OT programs. It wasn't until 1945 that you see the first two Black graduates um, into OT. So the profession has existed, right, at this point for 30 years, and then you have your first ever two Black OT students. So what happened in those 30 years, right? We're not going to talk about the impact of, again, of segregation. We're not going to, that's where the Black OTs are, being systematic
Hmm.
included, right? And then you get into the more modern, oh, well, they can't do da da da. And then, okay, well, let's look at it. Where are Black students when it comes to K-12 education? What about redlining? What about how public schools are funded? And so looking at what is really the matter
Hmm.
with these things. And so we get deep like that in this advocacy series. We're looking bigger, we're thinking deeper about it because it's so easy to say, well, they just can't do it, or disabled students can't do it, or they can. It's so easy to say that instead of saying,
Yes.
there's no ramp up into this program. So how could someone
Yeah.
who use it, can they not do it, or is this not accessible?
Yeah.
Let's be real about what it is. Um, so
So I love
I think
that.
that's what the series kind of will be like. And we've got three other sessions. I'll just go over the titles. So one is Solidarity and Solutions, Moving OT Education and Practice Forward, Tactics to Delay Justice, what they are and how to move around them. And then we'll end with what we owe each other, an exploration of love and solidarity. Um, Takeaways for this for people. First of all, it's 4 CEs per session. Suggested donation of $50, but it's a sliding scale fee. And of course, as always, it is free to attend. If you do not have the money, you'll also, all participants will get action packs. So they're guides for taking action in OT education and clinical practice. It's practical things. It's
Yes.
actual things you can implement instead of just talking about it. You'll also get occupational justice resources, a recording of each session, um, and then a copy of the book Freedom is a Constant Struggle, and then a copy of the book All About Love by Bell Hooks. So we're really excited about this. Oh, I want to mention, of course, all of the donations for this, if you pay for this, just goes to support diverse OT programming. It does not go into our pockets. We do not get paid. So I want to be clear. But that's some of the programming that we have coming up. So really, 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 really excited about that. And then outside of this continuing education series, we have, as part of the work that we do with our chapters, we have a general body meeting for our chapters once a semester. And for those,
Hmm.
we bring in our guest speakers as well. So we have had some great speakers. Our most recent talk, well attended, very powerful, Mason Munson talking about transgender affirming care.
Yes.
Very timely, very relevant. Uh, we had Dr. Ala Abu Arab back in December talking about OT and liberation for all with a focus
Hmm.
Palestine and what our obligations are as OTs to speak up for free Palestine. Oh, I'm like, who else has done? I have hosted one of our general body meetings. We went over the neuroscience of injustice. So really looking at injustice from a neuro
A
point
neuro
of view.
perspective.
Yeah, neuro perspective.
But thanks so much. That was sort of like an unplanned history lesson, a mini version of it, but really super interesting to hear. And again, brings us to the point of why it's so important that you're offering the space and really the ability for us to have these dialogues and conversations. I was part of one of your trainings about gender affirming care, and I came away from that training feeling like you're really hitting on topic and important continuing education conversations that others may not be talking about or others may not be offering. So that's precisely why I wanted to bring you on as a guest so we can really inform other OTs that, hey, look, this is this is an option for you. These are fellow OTs who are willing to have this conversation, and you're welcome to come on board. And I love that you're able to offer your trainings for free. Yes, we would love a donation, but more
Yeah, it's
importantly, we
more
want,
important that you're there. That is what
yes,
matters to us is like just show up.
yes, we want you here. So the fact that they're free and accessible to OT practitioners, I think is a beautiful, beautiful thing. But I want you to tell us how are you able to how are you able to make that happen? How is that possible? There's a lot of free labor involved in this venture.
Yes. So there is a lot of free labor. It's a lot of hard work. Hopefully, the labor won't be free for too long. We're working on getting funding and applying for grants and all of those things because it is a ton of work. I will not lie about that. Really, a lot of it is about just staying organized. It's good being able to delegate. Working with others has been great. It's been really cool to be able to get to network with people. Networking is huge. And that's also how we really find a lot of our guest speakers, because we're looking for people who don't typically get the mic. Um,
Hmm.
that's a big part of things for us. And just also, I would say a big part of what keeps us going, keeps our programming relevant, is that we try to keep our pulse with the people. What are people
Yes.
asking for? What do people want to learn? And so that a big part of the job is also just being active within the OT community, being
Yeah.
in paying attention and involved. Yeah.
Yes. Do you have any career advice for other OT practitioners out there who might be interested in jumping on, taking a course, getting involved?
So I would love if you're ever like, I'm interested in what you all are doing, or I work in a non-traditional OT space related to justice or something, please reach out to us at info@diverse-ot.com. That is the best way to get involved with us. We've had many a beautiful partnership uh, come about from people reaching out to us. We will also in the future, we're really working on revamping our website. So that will also be a near future opportunity to become a member with Diverse OT, to attend coming to our events. Please attend our events. Filling out our feedback forms that we send out. I know that sounds so basic, but it means a lot. It really directs the flow of what we're doing. But yes, we want to hear from everyone. And again, either email us, we're very active on Instagram and LinkedIn. Those are all great ways to find us, reach out to us, and work with us because we want to work with you. We want to work with everyone.
We will definitely post all of your resources and your contact information on our show notes so people know how to reach out and how they can participate in your amazing events. Is there anything else that you'd like to share with us regarding money matters, funding, how you're able to support your work?
Oh, absolutely. So, I mean, throughout this, I have always had a full-time job. So that is what pays my bills, is being an OT. As far as if someone wanted to pursue nonprofit work, just the recommendation is seeing what is it that you want to do, and what is the funding available out there for it. Funding is it's just a huge consideration for getting things done. And I most recently met an OT who like got a grant that pays their entire salary, and they work independently as a mental health OT. And it's just like, so there,
Ah,
there, it just depends on what area when you go to, but just thinking through funding, it just takes up so much space, unfortunately. It's the capitalism of it all.
yes.
It's like, how do you get people to donate? How do you get funding? How do you get grants? How do you get sponsorships? Ugh, it's a lot to think about. So definitely don't quit your day job.
But it sounds like you would be a great resource for this too, if somebody wanted to kind of just pick your brain.
Yeah. Or if
So
someone
Tony,
wants to fund us, if you're
yeah,
out,
that would be the best
it
case
will take
scenario.
your money.
So as we wrap up our episode, is there anything or what would you like our listeners to take away from our conversation today?
I would say that I would want people to really understand that culturally relevant care, culturally relevant training is really wrapped up in humanity. You can do all the trainings that you want. And what really is going to make the difference is empathy, humanity, seeing people for who they are, being curious about people, and keeping our hearts open because I think we're living in an increasingly confusing and difficult world, and it's easy to stop caring. And when we stop caring, that's really when we're in trouble. So we have to keep on caring. And that's my plan.
Amen.
And that is what diverse OT is also really out there to do, is we care and let's all care together. So yeah.
Ah, well, I encourage our listeners to get in touch with you to learn more about your super important work. And I want to thank you for sharing with us your journey. Yeah, I can't emphasize enough how thoughtful and important your work is. Thank you for providing us the space to have such dialogues and conversations, and just for the resources and the training and the knowledge that you're able to, really provide for us OT practitioners. So thank you so much, Toni, for all that you do and for sharing with us on the podcast today.
Very welcome. And thank you so much for having me.
And that wraps up another inspiring episode of the Uncommon OT series. Connect with me at www.transitionsot.com. And don't forget to sign up to be part of the Transitions OT community. By doing so, you'll receive my latest compiled list of uncommon OT practice settings, the latest news on mentoring offerings, uncommon OT live events, non-traditional OT resources, and more. You may also follow me on my social media pages on Instagram and LinkedIn. And if you love this episode, head on over to Spotify, Stitcher, Apple, and Google Podcasts to follow, rate, and leave a review. I also ask you to consider pledging your support to my Passion Podcast project by being a patron on Patreon. It is very much appreciated. Sending big OT love. Thank you so much for listening. Until next time.